Thank you for choosing Kellerman Dental for your upcoming procedure. We'll take great care of you and are committed to making your visit as comfortable and successful as possible.
Implant dentistry is a state-of-the-art method for tooth replacement. We believe you'll be very happy with the outcome of your upcoming surgery, and especially with the final restoration you should receive a few months from now. Every surgical procedure comes with risks, the possibility for complications, the occasional need for additional steps, and of course, the rewards. Implant dentistry is no different. Let's look at some of the risks and possible complications with implant placement surgery. Keep in mind, while most of these conditions are very rare and unlikely, it's best that you are aware of possible side effects. First, there could be an infection at the implant site or the area near the implant, such as the sinus or nasal area for upper implants or the floor of the mouth or neck for lower implants. Also, excess pain may not be completely controlled with our pain control protocol. If that's the case, we would look at alternative methods for pain relief. You could experience post-operative paresthesia, which means that you could feel numb or have less sensation either temporarily or permanently in the area of the surgery. There may be excess swelling and a possible hematoma, which is a black and blue mark at the site of the surgery or the injection of the anesthesia. You may experience uncontrolled bleeding after you are released from the office. Sometimes there is insufficient integration with the implant and bone, resulting in the loss of the implant or partial uncovering of the implant during the 6-month healing phase. It may be that we need to do additional bone grafting along with the implant placement to make sure the implant is as secure as possible. Or we may find that even with the best planning, the site where we want to place the implant turns out not to be ideal and is in need of further treatment before we can place the implant. With that said, we typically expect a very straightforward procedure in which the total appointment time from seating to dismissal, including placement of the implant, is about 60 minutes. If we're able to place the implant with no need for further grafting and the implant is stable, we will place a healing cap that peeks slightly out of the tissue. If you choose to grant us permission to place a dental implant for you as described, you should know and accept these risks, possible complications, and possible additional procedures. These risks and complications are rare, and your doctor will discuss with you what is best for your individual situation. Let's review some of the things you'll need to do on the morning of the surgery. First, eat breakfast and have whatever you want. Also, be sure you drink plenty of water a few days before your surgery and continue to take your normal medications as directed by your physician. Now that you're ready, let's talk about what you can expect during the surgery. Under local anesthesia, we attempt to place the implant in the pre-selected site. Nothing will hurt, but you will feel pressure as we work. We use a drill with water and suction, and you will feel vibration as we use this instrument. During the procedure, we may have you get up to take an X-ray, so please do not wear any earrings or jewelry on your head or neck. We can tell you what is happening as we work if you want to follow along, or you can bring your own music or close your eyes and mentally leave the room if that's your preference. It's your choice. Just let us know before we get started. After the implant has been placed, we will suture the area and the procedure is done. Then we'll go over with you any specific instructions we have for you and answer any questions you have. We will also schedule a follow-up appointment.
Thanks again for choosing Kellerman Dental.